Today we are going to discuss about pubis and ischium. Pubis is present anteroinferiorly, ischium is present posteriorly. First of all, we will discuss its osteology. Pubis. Pubis is present anteroinferiorly and it forms 1/5 of the acetabulum. Pubis is forming 1/5 part of the acetabulum. Pubis has following part. It has body of pubis, superior ramus and inferior ramus. Let's talk about body of pubis. Body of pubis has one border which is called superior border. Superior border is also called pubic crust. This is superior border of body of pubis. At the lateral end of superior border, tubercle is present. The name of this tubercle is pubic tubercle. So, body of pubis has superior border which is also called pubic crust. At the lateral end of this pubic crust, pubic tubercle is present. Body of pubis has three surfaces: medial surface, anterior surface and posterior surface. Medial surface. Medial surface is also called symphysial surface. It articulates with the symphysial surface of the opposite hip bone to form pubic symphysis, which is a secondary cartilaginous joint. This is medial surface of body of pubis. It has anterior surface. Anterior surface is rough and is directed downward and forward. Body of pubis has posterior surface. Posterior surface is smooth and is present on its inner side. Posterior surface is also called pelvic surface. This is posterior surface. So, body of pubis has superior border. Superior border is also called pubic crust. At the lateral end of the superior border, pubic tubercle is present. Body of pubis has three surfaces: medial surface which is also called symphysial surface, anterior surface which is directed downward and forward, posterior surface which is directed backward and upward and is smooth and is also called pelvic surface. Now let's talk about superior ramus. Superior ramus extends from body of pubis to the acetabulum. So this part is superior ramus that extends from body of pubis to acetabulum. Superior ramus has three borders and three surfaces. Let's talk about its border. It has superior border that extends from pubic tubercle to the iliopubic eminence. Okay, if we recall back, medial border of the ilium extends towards the superior border of the pubis, or medial border of the ilium together with the superior border of the pubis form iliopubic eminence. This is iliopubic eminence. So, superior border of the superior ramus extends from the pubic tubercle towards the iliopubic eminence. So this is superior border of the superior ramus of pubis. Again, I am repeating it again. Superior border, which is also called pectineal line. It extends from the pubic tubercle towards the iliopubic eminence. This is iliopubic eminence. Medial border of the ilium continues towards the superior border in the form of prominence. This prominence is called iliopubic eminence. So we have talked about superior border. It has anterior border. Anterior border extends from pubic tubercle to the acetabulum. This is anterior border. Superior ramus has inferior border. Inferior border form the upper margin of the obturator foramen. This is obturator foramen. inferior border form the upper margin of the obturator foramen. So we have discussed about three borders. Superior border which is also called pectineal line, it extends from the pubic tubercle to the iliopubic eminence. We have talked about anterior border is also called obturator crust. It extends from pubic tubercle to the acetabulum. We have talked about inferior border form the upper margin of the obturator foramen. Now let's talk about its surfaces. It has three surfaces. First one is pectineal surface. Pectineal surface is present between the superior border and anterior border. So between the superior border and the anterior border, pectineal surface is present. This is pectineal surface of superior ramus of pubis. Between the superior border and the inferior border, pelvic surface is present. Pelvic surface is always present on the inner side of the hip bone, which is smooth part. This is pelvic surface between the superior border and the inferior border. This is pelvic surface. Last one is obturator surface. Obturator surface is present between the anterior border and inferior border. So this is obturator surface between the anterior border and the inferior border. This is obturator surface. I am repeating it again. Superior ramus has three surfaces. Let's talk about its border. It has superior border. Superior border extends from pubic tubercle to the iliopubic eminence. It has anterior border. Anterior border extends from pubic tubercle to the acetabulum. It has inferior border form the upper margin of the obturator foramen. Superior ramus has three surfaces. Pectineal surface is present between the anterior border and the superior border. This is pectineal surface. It has pelvic surface is present between the superior border and the inferior border. It has obturator surface is present between the anterior border and the inferior border. This is obturator surface. Now let's talk about inferior ramus of pubis. Inferior ramus of pubis extends from body of pubis to the ramus of ischium. This is ramus of ischium. This is ischium bone. This is ramus of ischium. So inferior ramus of pubis extends from body of pubis to the ramus of ischium. This is inferior ramus. Inferior ramus of pubis and ramus of ischium together unite with each other to form ischiopubic rami. So we have discussed about osteology of body of pubis, superior ramus and inferior ramus.